Now let's go over to Haley at the My Suncoast Helpline.
Thank you, Alex. We are taking your We do have representatives from the Roskamp Institute, and joining us now is Dr. Andrew Keegan. He is a board-certified neurologist. He's also the associate director of the Roskamp Institute. Thanks for being with us tonight. Let's talk about some of the research. How far have we come with what we know about diagnosing and treating Alzheimer's and other dementia?
Yeah, one of the exciting things that's been happening is that we've always understood amyloid and tau as being part of Alzheimer's, but now we're actually into phase 3 trials where they're being tested in humans to see if they're actually beneficial. So people can participate in those type of studies to help figure out if those methods will actually help people.
And talk a little bit more about how those clinical trials work.
Yeah, clinical trials, when people are involved in clinical trials, they'll be closely monitored at our site, and they can keep their doctor. If they have a neurologist already, they're able to keep that doctor. There are many good neurologists in the Bradenton, Sarasota area and further out, so we like to keep them, and they would call our number and 256-8018, and we'll connect them to a coordinator who will keep track of them, and we'll be able to monitor them with imaging and different other methods.
And what do you see as being the biggest thing next on the horizon in the next few decades?
Yeah, in the next few decades, the goal is to capture the disease before it ever actually hits the person. So they may have the disease, but no clinical symptoms. We don't want them ever to get clinical symptoms. That's the goal, to halt it from it actually ever becoming clinically apparent. So.
Okay, and then any advice you have for families out there dealing with the disease right now?
Yeah, reach out to resources. It's a very challenging disease as far as the social support that's out there. The Alzheimer's Association, take advantage of all that. Caregiver stress is very dangerous, and we want to keep those people healthy as well. So.
Okay, thanks for
and one clinical trial on Alzheimer's disease. Let's check in now again with our My Suncoast Helpline and Haley with more. Haley?
Thank you, Scott. The number 7 joining us now is Dr. Andrew Keegan. He is a board-certified neurologist. He is also the associate director of the Roskamp Institute. Dr. Keegan, thanks for being with us. Let's talk about, we heard Scott mention some of the drugs that are available. How effective are these treatments for people with Alzheimer's?
Yeah, so the main medications that are available, such as Aricept or Namenda, are considered modestly beneficial. So they're not really disease modifying, which is the key. They're not really going after the key culprits of Alzheimer's.
So what do you recommend? What's the most important thing to help people deal with this, cope with this disease?
Yeah, we definitely recommend a good social network. We at Roskamp, we have a mild cognitive impairment support group meeting. The earlier you detect, so getting in for a free memory screen or doing a support group is helpful to, surround someone with a good support network.
And we always say early detection is important in most diseases. Is this one of those that it does make a difference if you're diagnosed earlier? Is there any different prognosis?
There's actually quite good research in that the earlier the disease is diagnosed, people tend to do better. We can kind of look at the hurdles coming up, get prepared for those hurdles, and it makes people's quality of life better, especially during the early parts of the disease.
And if people are calling tonight, what are some of the services or programs that Roskamp Institute provides that you think are helpful for these families?
Yeah, so on the beginning of the spectrum is the free memory screen, being involved in a trial where we're tracking people with a small memory concern, or being involved in trials where they're active with disease, or attending the support group or some educational programs that we provide.
All right. Thank you, Dr. Keegan. And you still have time to call your calls. Representatives from the Roskamp Institute are with us, as well as some other volunteers tonight. Now joining us is Dr. Kareem Yammout. He is a clinical neuropsychologist with the Carter Psychology Center. Thanks for being with us. Now talk about the role of a neuropsychologist in the diagnosis of Alzheimer's and other dementia.
Yeah, well, the neuropsychologist, where we come in, is in evaluating an individual who's having memory problems. As folks age, it's very normal to be a little forgetful. One of the key ways to finding out if your forgetfulness is normal or if it's abnormal is to get a neuropsychological evaluation. That's where we give you mental puzzles, like memory puzzles, concentration puzzles, and we look at an individual's ability to do those and compare them to what's normal for their age. So it's really vital for the early detection of any early problems. And that's really where doctors really want us to come in and help out.
And what are some of the signs and symptoms people should be watching out for and realizing maybe I or my loved one should be evaluated?
Well, I don't want to scare folks out there because a lot of them can be common. For example, it's very common in normal forgetfulness to walk into a room, forget why, learn a person's name and then forget it later on. When folks really ought to have very serious conversations with their doctors is when they have more serious forgetting. Things they used to be able to do and they can no longer do. Balance the checkbook. Repeat the same questions over and over again. Now, some repetition of questions, I do that. I honestly do that. I repeat my questions sometimes. But when it gets to where it's quite problematic and very frequent, it's important to talk to your doctor about that and get a really an in-depth evaluation.
And then once you do that evaluation, what can someone expect if they're going through that process?
Well, for the individual who is going through the process of having the memory problems, the evaluation is there where you work with somebody who helps you with the evaluation. But after that, the results are become very vital. For one thing, if the diagnosis is made and something is detected, then treatment can get started. And there's a lot of ways to define treatment. There's medication, of course, and primary care doctors and other form of medical doctors can do that. But there's other ways to help with dementia, because as we know, dementia doesn't affect only the individual who has it, but it affects the system, a family, and friends. And that's where it becomes important to have someone there on your team to help you learn how to cope with it, how to live effectively with it. And that's one of the things that a neuropsychologist can do, is work with the individual and the family to what I call treatment. And it is really to increase the quality of life, increase the effectiveness of coping, and the evaluation results can help in that as well. So when you do an evaluation and you understand a person's strengths,
you know where to take them from there.
Thank you.
All right.
Thanks for completing that thought perfectly.
Thank you. And remember.